I'm Dr. Pushpendra Ranjan. I'm a senior neurologist at the Indraprastha Apollo Hospitals, New Delhi. And we are very actively involved here in a very comprehensive epilepsy program. A comprehensive epilepsy program involves medical and surgical treatment of epilepsy. And we have here a very active surgical program in our department. Epilepsy is a common problem, more commonly seen in children and people of the old age. And it is a problem which is very commonly misdiagnosed. Misdiagnosed in the sense that it is overdiagnosed and it is underdiagnosed. So we don't have to overdiagnose epilepsy, nor we have to underdiagnose epilepsy. We have to give the patient a correct diagnosis of an epilepsy, because if we give the correct diagnosis of epilepsy, then obviously we use the correct drug for the treatment of epilepsy. And we also know how long we would like to treat these children. It is very important for us to definitely distinguish between epileptic and non-epileptic seizures, because non-epileptic seizures do not require anti-epileptics and have to be managed in a different way. Epilepsy is a disease which has lot of stigmas, misconceptions associated with it. It is important for all of us to make the general public aware that epilepsy is not a disease which is contagious. Epilepsy is not a disease which occurs because of ghosts. Epilepsy is not a disease which occurs because of some supernatural powers, but epilepsy is a disease which occurs from the brain because of an abnormal electrical discharge in the brain. Hence, it is extremely important for us to diagnose epilepsy correctly, treat epilepsy correctly with the right anti-epileptic drug, and I can assure you, we can control as much as 75 to 80% of patients of epilepsy with a single anti-epileptic drugs. And these children can lead a normal quality of life. They can go to school, they can study, and they can pursue any career which they want, and they can become anything which they want to become in their life. And hence, it is for all of us to work united for the sake of epilepsy and the sake of the children who have epilepsy. I would also like to stress upon that what one should do when one is in the house and one has a child who has an epileptic seizure. It is very important for the people in the house not to panic when they see an epileptic seizure. The first aid at that time is not to panic. Put the child on the patient to one side, loosen all tight clothes, do not put spoons or something into the mouth, do not feed the patient by mouth, and also do not try to stop the movement which is occurring, because this movement is a tonic-clonic movement which is coming from the brain and which will not stop till the time the epileptic discharge stops on its own. And most importantly, see that the patient does not fall off the bed or does not injure him or herself. So this is the first aid treatment of epilepsy, which is very, very simple. And after that, if still the epileptic seizure persists, one should take the patient to a hospital, and the only treatment which has to be given there, that the patient has to receive an anti-epileptic drug by an injection. So this is what you should do if a patient has an epileptic seizure. After that, the patient needs to be seen by a neurologist or epileptologist who will decide the further course of the treatment of this patient.